we'll just get started. We'll get started in a few minutes. Just wait for a few more people to come in. Yeah, we've got good representation from Boston, Minneapolis, Aurora, McHenry County, Chicago, University of Maine, Ohio. This is exciting. We've got all over. Proviso Township, Chicago, um, Washington State, Evanston. Yay, Evanston. Um, and yes, happy St. Patrick's Day, everyone, and happy voting day. Go vote if you haven't voted. Um, Kansas. All right, we've got really great representation. Michigan, Oregon, California. Woohoo! Awesome. All right. Let's see if we've got anybody else in the waiting room. Highland Park, Illinois. Yeah, we've got Illinois well represented. Crystal Lake. That's from the city of Chicago. Boulder, Colorado. Awesome. Thank you all so much for joining. Minnesota. Woohoo. Um, really appreciate everybody joining us today for this very important topic that is near and dear to our hearts here at Seven Generations Ahead, getting recovering food and feeding students. We work a lot in schools and we see how much food is going to waste, and share tables are really an amazing way to recover perfectly edible food and get it to students who might need some extra food. So thank you for joining us. We're going to start off with a poll. We would love to know what best describes your connection to share tables, like kind of what your position is. So the poll is up now, and want to know, if you're with a health department, school, it'll be really interesting to see kind of the representation here today. We were really hoping to reach kind of a broad swath of people and different stakeholders. So it looks like it's pretty even mix at this point. A lot of health department, which is wonderful to see. Community members, district administration, that is awesome. Love to have the decision makers here. All right. Yeah, so it's kind of even mix between health department and district administration, and then we've got even mix of the rest, parents, students, researchers, community members. So welcome everyone. Again, so glad you're here. All right. I don't know, Rebecca, did we share the results? I don't know if everybody saw that. Yep, or not. Stop sharing. Okay. We're kind of new to this poll thing, so bear with us. All right, so we're going to get started. Rebecca, you can go to the next slide. So just first of all, a little bit about us at Seven Generations Ahead. We're the ones, putting on this webinar today. So again, thank you for joining us. At Seven Generations Ahead, we are an environmental nonprofit based in the Chicago area. We build environmentally sustainable and healthy communities, and we tackle the climate crisis with solutions that are bold, equitable, and just. And we are currently in our 25th anniversary year, so very exciting. We've got a lot going on. So this webinar is kind of part of our larger series celebrating our 25th year. And we focus on the key issue areas of greenhouse gas reduction, local sustainable food, waste reduction and composting, and youth engagement. Next slide. So specifically, through the Zero Waste Schools program, we empower Chicago area schools to reduce waste, fighting both the climate crisis and food insecurity by shifting operations and minds towards generating zero waste through source reduction, recycling, composting, and food recovery, which is what we'll be talking about today. And we work with schools all over the Chicago area, helping them plan waste reduction strategies. We also provide on-the-ground support for operational changes. We create educational resources. And we also work to drive policy change at the state and federal level, changes that will kind of impact zero waste in schools. Next slide. So before we start talking about share tables as a way to reduce food waste, we just want to give some context about the scope of the problem of food waste, specifically in K through 12 schools. Many of us, haven't been in a school lunchroom and really, it's helpful just kind of understand what is happening there. Over 7 billion school meals are served each year in the US, and much of that food is going to landfills rather than nourishing students. And we've got some kind of startling statistics on this slide. I'll just highlight a few. The World Wildlife Fund estimates that food waste alone in US schools equals 530,000 tons annually, which equates to $1.7 billion a year. So not only are we throwing away food, we're throwing away a lot of money. And according to a study done in 2019, 31% of vegetables and 41% of milk that is served in school lunchrooms is wasted. It's not eaten, it's thrown away. And we work a lot with Chicago Public Schools, and we're currently working with 18 schools where we've implemented commercial composting and recycling, as well as share tables. And part of our work is doing waste audits when we start the program. And we diverted we calculated that those 18 schools alone are diverting 29.6 tons of edible food. That's unopened whole pieces of fruit, unopened milks, and packaged items from the school lunch. So 29.6 tons every year are wasted. So that's the equivalent of 49,333 meals. We use the Refed Impact Calculator to calculate that. So that's a staggering amount of food that could be getting to hungry students. And when we throw away all of this food, it's also wasting the water, energy, labor, and all the other resources that go into growing, transporting, processing, and cooking that food. Next slide. So here are just a few of the many factors that could be contributing to the high levels of food waste in schools, because you might be wondering, well, why are students not eating? And it's very complicated. And part of our job is to kind of peel back the layers of the onion and figure out what is happening and where is all of this waste coming from. So students quite often don't have enough time to eat. They maybe after waiting in line, they only have 10 minutes of seated lunchtime, maximum usually 20. We see a lot of whole fruit being wasted because either kids just can't finish it, or maybe if they're younger, they can't peel that orange, or they're just not interested in eating a whole piece of fruit. We found students prefer to eat cut up fruit. Serving pre-plated meal items, that often happens even if schools are doing offer versus serve. The students are being served everything and not being given a choice. Often lunch is served too early, so they're not hungry yet. We've been in schools where they start lunch at 10:30 in the morning and the kids have just had breakfast, 2 or 3 hours prior. So next slide. So today we're going to focus on how schools can use share tables to rescue the edible portion of all of this food waste from the landfill and redirect it to hungry students or community members. A share table is a place where students can leave items from the school lunch, not from home lunch, that they didn't eat, so unopened factory sealed items or whole pieces of fruit, like I mentioned. And these items can include perishable foods as well, such as milk, yogurt, cheese. So there's two different kinds of share tables. There's a one-way share table where students might place the items, but they don't take off of the table during the meal period. So those items could be reserviced, redistributed in the school, or donated to an outside partner. And then a two-way share table is where students place the items, but then they can also freely take those meal items. If they're still hungry, they can take off of it during lunch. Next slide. So as I mentioned, we work with a lot of schools and we've conducted a lot of waste audits during which we've collected share table eligible items. And we've also worked with schools to set up share tables. So these are just a few examples of what we have collected. And this is not unusual. So these are all different schools, and you can see those share bins are full. And it's mostly whole fruit that we are collecting. And often there's a lot of milk as well. So it's pretty amazing that, we were able to recover all of this food from the landfill, and kind of crazy to think that if we weren't there, all of this food would have ended up in the garbage. So next slide. So in order for share tables to have the most impact, it's essential to make sure that all stakeholders understand the parameters. So creating standard operating procedures is essential. And posting a one-pager in the lunchroom is very helpful so that everybody is on the same page. And then once these materials are created, you contact your local health department to kind of review and make sure that aligns with their food safety requirements. I'm not going to go through all of this, but it is essential to make sure that you have a plan for any surplus food. So any food that's left on the share table at the end of all of the meal periods, inevitably there will be food left. You want to make sure that you have a plan for that food, where it's going to go, so that it doesn't end up in the garbage. Next slide. There's often a lot of confusion around share table protocols about what is allowed and what isn't. So here are some policies at the state and federal level that support the use of share tables. So we want to make sure everybody knows that it is encouraged by ISBE, Illinois State Board of Education, USDA, and there's also an act in Illinois called the Unused Food Sharing Plan that says all schools must have a plan for that unused food, and it has to be written into their local wellness policy. So we will share these links with you later, and there's a lot of guidance about how to write it into your policy as well as resources, how to go about doing that. So now we're going to dig into some resources and research to answer some common questions and concerns about share table safety and implementation. So first up, we have Dr. Melissa Prescott, a behavioral nutritionist whose research examines behavioral design strategies to improve U.S. nutrition security and environmental sustainability, particularly among children and their families. She's an assistant professor in the Department of Nutrition and School of Medicine at Case Western Reserve University, and recently conducted a multi-state share table pilot. She's also the lead author of the Share Table Toolkit for Schools, which she will share with us in a bit. And then next up, I'm just going to go ahead and introduce our three panelists, and then they'll just go one after the other. Next up, after Melissa, we'll have Dr. Gabriela Pinto, who's a fourth-year MD, PhD, MPH candidate in food science and epidemiology at the University of Illinois Urbana-Champaign. And as a food safety scientist, she's contributed to research projects valued both by industry and public health departments. And then lastly, last but not least, we will have Lauren Gibrick, a special education teacher in Chicago Public Schools who has long been an advocate of sustainability in schools. And we have worked alongside her twice in her two different schools to implement waste sorting, including composting, recycling, and implementing share tables. So she's going to share her direct experience working on share tables in schools. So we've got Melissa up next. So take it away.
Thanks, Becky. So yes, I'm excited to be with you today to talk about one of my favorite things to talk about, school share tables. You can go to the next slide. So for all things share table, this toolkit can be very helpful. It's free to download, and the materials have been piloted in more than 40 schools. It was developed by ShareTable, food safety, and public health experts with lots of input from school staff. So we have a poll, just another quick poll, if you want to bring that up, just to see how familiar the folks in the room are with the toolkit. Okay, so it looks like we're trending towards most people never having even looked at it, and then only a few having actually used the toolkit. So that's great. I have a lot to share then. I think we could go to the next slide. So when you're setting up a share table, or maybe you're revamping an existing one, you'll want to start out by deciding what kind of share table you want. And so, there's lots of small decisions, which specific food items are you going to collect? Are you going to have a share only, or like a one-way table like Becky described? Or do you want a traditional share table, which we call a share and take, where students can both put items on and take items off the share table during the lunch period? Are you going to keep your food cold? And like Becky mentioned, what are you going to do with items at the end of the day? So in the toolkit, we have a quiz that you can take that asks you questions about your school and gives you suggestions about what share table type might be the best and fit for your school, as well as some other tips to help you understand the differences in some of these decisions. You could go to the next slide. So the answers to all of this will help you decide on which standard operating procedure template you can use. And so in the toolkit, we have multiple templates of SOPs, depending on what type of share table scenario you decide to go with. And so if you're not familiar with SOPs, basically these are the steps that your school is going to take to make sure that the food is safe for kids to eat. And so it outlines specifically what's going to happen before, during, and after meal periods and who's doing what. And, we recommend that you develop an SOP just so that if someone raises a concern about the share table, you'll have proof to say, we have a well thought out plan. This is what we're doing to protect our kids. And, bottom line, if somebody gets sick from a share table, or even if someone gets sick and they think it's from the share table, schools might no longer allow a share table to be in place. And so it's important that we're proactive to not just protect kids from getting sick, but also to make sure that the share table can be around in the long term. So the USDA does require that all share tables comply with local health codes and recommends that they are approved by the local health department. And so this SOP is your first step to that process. Next slide, please. So next up, you can dig more into the details and figure out the logistics. Like, for example, where's your share table going to go? How and when are students going to use it? And so, for example, some principals might say, oh, I don't want the kids getting in and out of their chairs to go use the share table during lunch. And so in that case, some schools might decide to put the share table right after they exit of the food line and require students to engage with it at that time point. Other schools might maybe have a share table that's on a cart and you'll see like cafeteria monitors kind of pushing the share table throughout the cafeteria, kind of bringing the table to the kids, so there's not one silver bullet that's going to work perfect for each schools. And so, we have some resources in the toolkit to help you kind of understand the pros and cons and help solidify some of those details. Next slide, please. Thanks. And so at this point, you'll be ready to get input from folks. And maybe you've already started doing that by this point, but you really do want to talk to anyone who their job is going to be impacted by the share table. And so, all right, looks like we might have some folks in the waiting room that we could let in. So food service staff are probably number one on the list for you to reach out to. You'll really want to learn any concerns they have and let them give input on how to make it more as realistic as possible, as well as cafeteria monitors. So we have a survey that you can use in the toolkit if you want to get feedback that way. You'll really, the more input that you allow people to have into this process, the more engaged they're likely to be in, making your share table a success every day. And then you also want to get the principal's blessing, of course, and speak with a custodian. One of the benefits of a share table is that the garbage bags are less heavy that have to go in and out of the dumpster. So there's, a lot of points there, but you definitely want the custodian on your team. Next slide, please. And so now that now that you've talking to your team and you all are on the same page, you're ready to engage with the health department. So my team has done a lot of qualitative research with health inspectors. And so my tips on this slide are coming straight from the mouths of health inspectors. And so one of the things we've learned is that, the health department really wants to collaborate and work together with schools to help figure out the best ways to, keep school meal programs safe. And, they want to hear from you about about how things are going to work best at your school. But one of the first things that you're going to want to know from you is about how you're training the staff, like who is being trained, what are they being trained on, and when is the training happening. They'll also want to see a standard operating procedure. And one of the top things that they're looking for might surprise you. It's not about milk. It's actually, they are very interested to know how you're going to reduce the likelihood of norovirus being transmitted in your cafeteria. So Gabby will talk more about that. If your health department tells you that, share tables are against the local health code, it is possible to ask for a variance. And so a variance is basically special permission to do something that is against the health code. And so you can't get a variance without a very without a strong SOP, sorry. And so that's one of the reasons why we really promote doing that first. But bottom line is, if you decide you don't have the capacity to collect a lot of different foods on your share table, or if your health department doesn't want you to be able to, limits the amount of foods you can collect, just start out collecting what you can. You could start out with just packaged foods like craisins or goldfish or even condiment packets, and then you can work your way up to being able to collect more food over time. Next slide, please. So as I mentioned, training is really important and should be prioritized. The toolkit has you covered there as well. We have templates and lesson plans for in-person training, and then we also have free online training available, which meets the professional development requirements for food service staff. And so I recommend that definitely the food service staff should be trained, and then cafeteria aides, if there's any way you can get them trained, or at least make sure they're on the same page about the rules, that's really ideal. Next slide, please. We also have a lot of different communication tools. So the share table is something that needs to be, everyone in the school community needs to be made aware of. You want to prioritize giving letters to parents, particularly parents of children with allergies, so parents can talk about how they want their children to engage with the share table. And then one thing, no matter what you do with student training, something that is really important is that you talk with students about the purpose of a share table. So kids have really big hearts and they really want to help people. And so it's important that you let them know that they should not be taking extra food from the line just to share. Sharing is something kind and helpful. But we have to tell them that it's not good for the earth, and it's not good for anybody to take more food than what they could eat. And so that make it clear that sharing is only for food that they are unable to finish during the lunch period. It's also ideal to have student council or some other help to kind of be there the first week or two that the share table is in existence, to help coach the students and remind them to use it. Next slide, please. So those are the end of my tips, but I do want to mention that in our multi-state share table study, we estimated that over 1 ton of food per school per year can be diverted from the landfill with share tables. So they're very powerful in terms of their ability to protect our planet and provide opportunities for hungry children to have healthy food. And so because of that, it's really, important to hone in on making sure we mitigate the small increased risk of illnesses that share tables present, instead of, completely eliminating the opportunity to recover food just because there is a small risk present. But Gabby will dig into that with more detail, so I'll go ahead and turn it over to you. Thanks.
Wonderful. Thank you, Dr. Prescott, for teeing up so much great information about shared tables ahead of my part of the presentation, which is going to focus on food safety. So I'm Gabby Pinto. I'm a PhD and also MPH candidate at U of I. I worked on this project collaboratively with Dr. Prescott. And this is also a project that's very near and dear to my heart. So instead of kind of taking you through the more technical information in a standard research type presentation today, we thought it'd be kind of fun to do something a little bit different, though we will talk some technical information, and we're going to do this as a kind of type of myth busters, so myth or fact. Next slide, please. So our research, just to kind of level set everyone, focused on three main food hazard commodity combinations. When we're talking about food, we're talking about, like you see in these pictures, apples and milk were the two food commodities that we focused on. And when we talk about hazards, we can be talking about a lot of different things in food safety, but particularly what we're concerned with respect to share tables are what we call microbial hazards. And I'll refer to them mostly as germs throughout the presentation, but just to kind of specifically let you know what the share table toolkit covers in our research, we looked at norovirus in apples to assess the spread of norovirus. We looked at something called Pseudomonas species, which is a spoilage germ in milk to assess milk spoilage. And finally, we looked at a harmful germ named Listeria monocytogenes in milk, and this was to assess milk safety. Next slide. So, hope everyone's ready for some Mythbusters, and we're going to kind of do this as, do we think it's a myth or truth? And we're going to try to use Zoom reactions. So if everyone can navigate and locate that little heart at the bottom of the Zoom panel, you'll see a little arrow, or you can even just click on the heart, I think, and you'll see a little green check and a red X, and we're going to use that for myth or fact. So if you want to participate, be ready to use those reactions. Next slide, please. So let's start with this. Student hand washing or sanitizing always reduces the risk of norovirus transmission. Do we think that this is a myth or a fact? I'll just kind of, oh, that's nice. Zoom is kind of summarizing them on the right-hand side. Looks like we have most people thinking that this is a fact and not a myth. So that's, I'll let a few more seconds. Okay, so it looks like we got somewhere about 24 people thinking this is true and 8 people thinking that this is a myth. So let's go to the next slide. Actually, what I'm going to reveal is that this is a myth, so it's in dissonance with what the majority of us thought. And let's talk about why, because I know that our knee-jerk or maybe our intuition would tell us that hand washing and sanitizing is always a good thing. Next slide. Let's talk about first norovirus in schools to kind of help us understand about why hand washing and sanitizing isn't always, or where and when we do it is always the best strategy. So norovirus is a concern in schools because it is the most common foodborne illness in the United States, and it's endemic in that sense. I've pulled some screenshots from some recent norovirus outbreaks that have been observed in schools in the United States. These don't necessarily indicate that these originated from a cafeteria, right? Or a shared table, but it's just to point out that we know that norovirus spread in schools is very real and it happens I think probably every year. I don't know if it gets to be this big of an outbreak every year, but it happens, right? And this is because norovirus is highly contagious and kids touch everything, right? They share chapstick, they touch each other, they're giving each other hugs, especially little ones, touching each other's faces, whatever, recess, playtime, school cafeteria time. So we know that kids can be a little bit gross in that sense. And so that's kind of maybe how we can start to think about how norovirus could be spread in cafeterias. So if kids show up to school with contaminated hands and they touch food items, and then those other children go on to eat those food items, or they go on to eat those food items, this is how norovirus can be spread. And norovirus is actually a foodborne germ that can be shed by individuals for up to 3 weeks. So even when you're not actively sick, you can still spread norovirus after you've been actively infected. And this can happen whether there's a shared table present in the school cafeteria or not. Next slide. And so, yes, exactly. I see someone in the chat said always, and that's exactly the point that the word you had to hang on in that myth or truth. And when and where you wash your hands is what matters. So if students wash or sanitize their hands before entering a meal service line, then that kind of would prevent germs like norovirus from spreading to the foods that they subsequently touch. If students wash or sanitize their hands at a share table after they've already gone through the meal service line, touched food, that they then share back to the shared table, it's actually too late at that point, right? Because we've already allowed for the opportunity for norovirus to be spread to those food items. Next slide, please. And this is going to kind of feed into our next myth or fact. So let's take a look at this one. Knowing now what we know about norovirus and when it's good to implement those strategies, what do we think? Norovirus illness increases a lot when we let kids access fruits with edible peels on share tables. Do we think that? Okay, I see a thumbs up. I see some changes in the numbers. Okay, ooh, good. This one looks a little bit more even. So we're a little unsure, but I think we're leaning towards true. But we can go and let's reveal the answer. This is actually, again, a myth. But let's talk a little bit more about why unwrapped fruits with edible peels and shared tables and whether or not norovirus illness prevalence changes a lot when we introduce the shared table. Next slide, please. So to kind of talk about norovirus and apples on share tables, why would unwrapped fruits with edible peels be a problem? I think Dr. Prescott almost alluded to this a little bit when she was talking about the concern around apples in share tables. And this is because there's no barrier of protection for the edible skin of the fruit. So if you think about an apple or a pear, you bite directly into that versus something like a banana or an orange, you got to peel, right, to get through the part that's actually edible. And so again, if we think about how contamination can spread in a cafeteria, contaminated hand touches the fruit, contamination's on the fruit, that allows us the potential for the disease spread. When we studied this, in our lab, what we actually found through doing computational models that represented school cafeteria share tables and kids grabbing apples, sharing apples, discarding apples, consuming apples, some infected with norovirus, some not, is that in a traditional cafeteria, we kind of had this baseline proportion of infected children out of the total number of children. We call that illness prevalence. And when we added a share table, there was a modest increase, actually. So it wasn't a lot. So I know I'm kind of tricking you guys a little bit with these myth or facts and hanging on to some of those very specific words in there. But the point is to kind of talk through, is it a lot? Is it a little? Is it modest? And what we saw is a modest increase. However, next slide. What we also found through doing this research is that we have a lot of very good options to manage risk. When we implement share only, or we also refer to these as one-way share tables, we found that this was able to reduce that illness prevalence, that norovirus proportion of infected children out of the total number of children. And we can implement this practically at different times of the year, perhaps. If you've ever heard of norovirus referred to as the winter stomach bug, that might be a season of the year where we might need to implement one-way share tables or share-only share tables for items like apples. Or if you notice that kids are frequently being called in sick, that might be a time where you kind of convene and think through this might be a good time for implementing a share-only share table. The research also showed that requiring hand washing or sanitizing before meal services start would be a very effective way to reduce illness spread. But I think that we also understand that this is challenging, right? Like getting a bunch of kids to wash their hands before they go into a cafeteria is operationally maybe not feasible. However, it is a good strategy to reduce the prevalence of the norovirus, is what we saw in our research. And another option that you might have is to collect and wash that fruit before students can access it again. So you might be able to just specifically do share only for apples. If we just collect those apples and then wash those at a later time and offer those again later, that might be a strategy for reducing the potential for norovirus to spread in a school cafeteria. Next slide, please. Okay, so that was kind of around share tables and apples and norovirus. Let's kind of shift gears. Remember, we also studied milk was one of the food commodities I mentioned at the beginning, and let's talk about milk spoilage. So milk can spoil in a cafeteria system with a shared table. Do we think that this is true or false? Looks like we're heavy leaning on true. Great. Let's go to the next slide. And you are correct. This is true. Milk absolutely could spoil in a cafeteria system with a share table. However, it could also do so in a cafeteria system that's just traditional and doesn't have a share table. So let's talk about what our research showed drives milk spoilage. And that might, like, at the surface level, you might be like, whoa, like, why would we be thinking that milk is going to spoil in schools? Isn't this something that comes from USDA vendors? Shouldn't the milk be tested before it comes to schools? And you'd be very correct in thinking that, because it is. However, we know that in reality, because of data that we have for pasteurized milk samples that have been taken from milk facilities, that sometimes something called post-pasteurization contamination happens with spoilage germs. And that's not necessarily going to be detectable at the time milk is tested. If you're from a health department here, you certainly know what the pasteurized milk ordinance is. So we know that milk has to meet a certain, I'll call it germ criteria, before we can sell it in retail or to schools. However, if this post-pasteurization contamination happens and we don't detect it, then now we've created a possible scenario where milk could spoil sooner than we might expect. And perfectly maintaining the cold chain is also something that's really hard. We know through the model food code from FDA and from other local health codes that milk is ideally always at 41 degrees Fahrenheit or lower. However, in reality, right, milk's moving from a facility to a truck, from a truck to a school. That perfect 41 degrees Fahrenheit may not necessarily always be maintained perfectly. And we also know that just because the practicality of student picking a milk out of a fridge and then bringing that to a table and then maybe even putting that back in a fridge or a cooler, that can lead to some temperature change, mostly temperature increase, but that would be normal and we would expect that, right? We take something out of the refrigerator. As that happens, things start to get warmer. And so this can create a scenario in which if spoilage germs are there, they could grow. And sometimes all spoilage germs need is time. But also temperature can very much influence germs' ability to grow, because we know that just like us in the winter, if you're from Illinois or a cold place right now, I know it's cold outside, you want to be warm. The germs like to be warm too. They very much enjoy being warm versus cold. And so that scenario can also allow them to grow. Next slide, please. And so what our research showed about milk spoilage in cafeterias with share tables is when it happened, it was when we purposely took a subset of milk cartons and we contaminated them with a really fast growing spoilage germ. You put it in the milk, it loves to just take off and start growing, because we wanted to observe what the worst case scenario would be. And what we found is if we take that milk out of the fridge for 2 hours a day, just leave it at room temperature, that after about 3 or 4 days, that milk would spoil. And we determined spoilage by it reaching this threshold of number of germs that's just very, very high. So we would be able to perceive off flavors, off smells at that point. We also, however, left milk in the fridge that was contaminated with these same spoilage germs, and we just sampled them once a day. What we found is that even if milk's just sitting in refrigeration and it's not experiencing that temperature change every day, then after 4 or 5 days, it might spoil, just depending on the time of year. We tested this in both the summer and the winter. But when we start to think about from a modeling perspective, so again, going back to simulating how students might interact with food items in a school cafeteria, we find that based on the way students behave with consuming, discarding, and sharing milk, that a student receiving a spoiled milk carton would be very rare, because most milk is actually consumed before it has the chance to spoil. We see somewhere about 99% of the milk that is consumed in the model that we build is consumed in the first 2 days. So it'd be very rare for the spoilage germ to have enough time and temperature to actually increase to a level that would be considered spoiled. And we also typically only saw this in those very rare instances when milk initially had a lot of germs in it, which is also very rare. And then it's also important to consider where this happens, right? Because like I mentioned, when we let milk just in the refrigerator, didn't temperature change the milk at all every day, it's still spoiled at some point, right? And so what we observed in our research is that germs actually grew more during that time in refrigeration. So when you put it in the refrigerator after being on the shared table versus on the shared table. So that just goes to show you that time really matters. However, temperature also matters. We're not trying to insinuate that poor temperature control is okay. You still are probably, depending on your local health code, maybe even required to monitor something like that. And we found that when we have warmer overnight refrigeration temperature, that we start to see more spoilage, and that happening sooner rather than later. And also, we know that there's a spectrum of different meal service lengths, right? If we simulate something like over 4 hours of meal services and leaving milk out for 4 hours, this can also lead to more milk spoiling. Next slide, please. But what we find is that when we institute better temperature management on the shared table, that we can reduce even those rare instances of spoilage. So maybe we put something like a tray with ice or ice packs, a portable cooler with ice, maybe a refrigerated steam table tray that the milk sit in. And this just goes to show that there are different strategies that we can institute to kind of reduce that spoilage. And also, like, nobody likes drinking warm milk, right? Warm milk, kind of gross. Probably don't want to drink a carton of milk that's been sitting out for 4 hours. Next slide, please. Okay, and this finally brings me to this last component of our research, and we'll do this last myth or fact. So, what do we think? Implementing share tables would cause milk to become unsafe. Do we think that's a myth or a fact? Okay. I see us leaning towards this being a myth, and I'm very glad to see that, because next slide, this absolutely is, oh, sorry, Rebecca, next slide, please. Sorry, this is a myth because milk is pasteurized. The milk that goes to school is pasteurized, and contamination with harmful germs is very, very unlikely. And I'm going to talk you through a couple of points in our research, which we found is that on average, it would take hundreds to thousands of years before we would actually observe one person or child becoming sick. Next slide, please. And so when we studied milk safety in cafeterias, I think the first question that might naturally come to your head, which I somewhat addressed in the previous slide, is, isn't all milk that's processed for schools meant to kill all harmful germs? And the answer is yes. However, in extremely rare instances, not for school milk, thankfully, there's not been an outbreak where we've actually seen this associated with school milk. Harmful germs have contaminated milk after pasteurization. And again, if you're a health department or you're very food safety savvy, you definitely know that anything in the United States, typically that's ready to eat, should not have detectable levels of any harmful germ, right? That's why we test products and we process them to render them free of harmful germs. But since that we wanted to address milk safety in some way, we chose to study that pathogen that I mentioned at the beginning, or that harmful germ called Listeria monocytogenes. And what our research showed is that harmful germs rarely increased tenfold. I tried to show this little graphic by what I mean by tenfold. So as scientists that study these little bugs, we love to kind of think about tenfold changes. It's something we talk about a lot, and we rarely saw an increase in tenfold by the time that milk was consumed. And then we also found that the likelihood that a child would become sick is so rare that it would typically take over 2,000 years for a single child to get sick, considering actually all milk servings across all schools in the United States. When we multiply by that about 100K of public schools that exist. And then in the worst case, we found that it would take about 100 years. But again, we can implement strategies like trays with ice or trays with ice packs as a way to reduce that risk. In this case, to increase the amount of time to which we would observe a single illness. So that's what I have for you guys on just some milk safety, milk quality, and apple safety in school cafeterias with share tables. On the next slide, I've just pulled up this QR code for the toolkit for you again. Dr. Prescott had previously shared that. We also have a little QR code if you have very specific feedback that you might want to share or suggestions. That's just kind of an open field text form for you to dump that in if you have any thoughts. But we also have some poll questions that we're going to pull up right now as well. Just given everything that you've learned in the webinar here today, or maybe because of your own background information that you have or experience with Toolkit, just kind of want to take your temperature on your intention to use the toolkit. Although I recognize this also might have something to do with your role. So just kind of wanted to assess that. And it looks like, yay, we see some yeses, which is great. And we do hope that this resource is very helpful for you guys. I think we have one more poll question that we'd like to do at this stage. So I'll ask Rebecca to launch the next one. And if you have right now, in case, going to that next form that we have in the little bottom QR code, is something you want to do later, great. But if you have any thoughts right now, feel free to type those in the chat. We just have a short little answer for you. And with that concludes my part of talking about the share table from a food safety perspective. Happy to answer more questions later, but I think it's time for me to pass it to the next panelist.
Lauren, you're up. Now we can hear what it's really like in schools and boots on the ground. Take it away,
Hi,
Lauren.
he got it here. My name's Lauren Gibrick. I am a special education teacher at Chicago Public Schools. I have actually worked with Becky numerous times. We've set up 2 schools in Chicago, and we use share tables all the time. The first thing is definitely how we get people in the building to participate, including, getting permission from our principals, how we need our teachers and staff support. The kitchen staff is involved, our custodial staff, and of course, our students. Go to the next slide. So with the share tables and with our kitchen staff, the first thing they always ask is like, how is this more work? Yes, it's a little more work, but it's completely manageable. Ice packs will need to be prepared for keeping milk chilled. And then also in the share bins to make sure that they're ready to go. They'll go on the same table. And then for our custodial staff, it's kind of a yes and no of being more work. Bins and milk buckets, for example, or liquid buckets will need to be cleaned regularly. However, there's no more carrying all that liquid through long hallways and outside and to get them to the dumpsters, and the amount of weight that they're taking out is much, much less. Next slide. Our teachers, of course, are our point persons. We're always promoting to students about our share tables and all the other green activities that we're doing. We're training our students, and we're also building a community and culture of keeping these things important within our student body. And we are teaching our students how being green can be easy. We always have helpers that are helping get the things from sorted correctly, including into the share containers. And we also have helpers in the school I'm currently in. We do 2 separate systems for lunch and for breakfast. So I have helpers for breakfast too, and we're always building a community. We can go to our next slide. So one of the wonderful things that we do to keep our milk cold is that we have ice packs, such as the ones that you see here. These ice packs are what our kitchen staff takes care of. They make sure that they're clean and that they're frozen and that the milk, and they're placed in the bin so that the milk goes on top of them. Next slide, please. Bins are also very important because we're going to be having some students that are cleaning them and also our custodial staff. There's always our typical food safety approved containers, but also making sure that they have smooth bottoms is really important because sometimes things may leak and scrubbing out bins can be difficult at times, and making sure they're smooth and so they're easy to clean. Thank you. So here's an example on the third floor. This is for our middle schoolers, and this is what they use for breakfast. We have, of course, our share bin, the recycling, the liquids, things that go in the landfill and the compost. And throughout the morning, the kids are using this for their breakfast items. I come and check in on them because I switch rooms, and I find that there's maybe one or two milks left in there that I always just pour out. And then any food that's left is always gone by the time they go to lunch because the kids are grabbing them on their way down too. And then my green team helpers, who are my breakfast helpers, take the compost downstairs to just have them dispose of correctly. Next slide. This is my second floor. This is another way that we do it. For breakfast is my second floor. We, of course, have the share bin, our liquid, recycling and landfill and compost, and checking on having the kids check on those on the second floor. And they know to, by a certain time, if they see a milk, that we are just pouring it out. And there's never many left in there. This school is a very heavy milk drinking school. So we're finding that we have very little milk left over and a very little food left over. Maybe sometimes there's some bags of raisins, but not much more. You can go to the next slide. We also have pre-K in this school that I'm in at Yan, and each pre-K room has their own system, and they have share bins too. They are with the milk. We are not using freezer bag, or sorry, ice packs with them, but they are making sure that they're pouring it out and recycling their cartons. So they are doing that, but packaged food such as the cereal you see, those are always staying in there too. Thank you. And this is one of our cafeterias with our share bins, and you can see where the food goes, and there's a separate one for the milk where our ice packs go. Go to the next slide. We also have a small cafeteria where some of our kids with special need a little more quiet space. So we found that they also needed a way to sort their lunches, and they also have a share bin. Now at Yan, with the leftover milk, between all three lunches, they are big milk drinkers, and there's rarely any left. So we are rarely reusing any of the milk because they're gone. And if there is any left, we're finding that there's maybe like 3. So we're really not wasting much of any at this particular school. And then, of course, one of the biggest outcomes, so between my first school that I did was at LaSalle Language Academy, where we were using share bins and the process of composting and sorting our trash. And we were ranked by PIRG as the number 9 nationally ranked for fighting food waste, which was a really great honor. And then we went from 9 black garbage bags to 4. And at this particular school, we had lots of milk left over and decided as a community to get a mini fridge at the time. And we were putting those in for kids for after school to have. And then the difference, I would say, too, at Yan, which is the second school that I've done this program at, we went from 9 black garbage bags to 1. We have like 0 to 4 leftover milks, which is not a lot of milk left over. Our share bins, and we have share bins for breakfast in all the rooms, and we have multiple sorting stations. We are constantly training our kids. When we start running these programs, we go to each homeroom and show our videos and how to sort and why we're doing this process. And then when they're the first few weeks, we have extra staff helping teach the kids how to go through the process. So that's what I got. Thank you.
Thank you, Lauren. That is awesome. Thank you for all of your hard work that you've done over the years. And your school is very lucky to have you. You've done, incredible work. And I just love seeing all the sorting stations all over the school, including in the preschool rooms and for breakfast. Just what an awesome model. We've got some great questions. We only have a few minutes. We are happy to hang on to answer questions, please leave as you need to, and we will answer the questions in a follow-up email as well. So if you do have to log off, you'll still be able to see the answers to the questions. Our ending question is, would you be interested in a follow-up webinar about this topic? And if so, are there specific aspects of share tables that you'd like to learn more about? Anything we've talked about that you're curious about, that you have concerns about? We would love to know. And we also just want to make sure we get this in, and then we can jump to a couple questions, kind of action. We always like to end our webinars with, taking action. What can you do? Well, if you're with a health department, we highly encourage you to encourage the schools in your area and the districts in your area to set up a share table, to start implementing share tables in your area and support them in doing so. And if you have the wherewithal, take a look at the toolkit and create an SOP to share, or even a one-pager with the parameters that you would like them to follow. I think, coming from this information coming from a health department will go a long, long way. And if you're a school stakeholder interested in share tables, please reach out to us if you need support. Our information is here on this, was on this slide, and it'll be in the follow-up email. We love to support you in rolling out share tables, or if you're interested in composting, recycling, any sort of waste reduction diversion initiatives. And if you have questions, concerns, again, specifically about share tables, reach out to any of us. We're all happy to help. Let's see, we've got some really good questions. Where to even begin? Let's see here. We've got one, I think somebody asked, and I think this is an interesting question about, the negative perception. Are students afraid to use the share table? Like, how will they be perceived? And maybe Lauren, you could answer this one. Have you seen any kids have any issue with taking from the share table?
No, definitely not at all. When I was at the first school, LaSalle, one of the big things was that there wasn't a ton of food for like snacks for athletics after school, and they would come running into the share bin, and if they didn't like that bag celery during lunch, they sure liked it after. So all those things didn't end up going to waste for sure. I've never had anyone negative perception at all about it. I also, or taking, like, they're excited if they're getting an extra milk. Like, that's something that they're glad to have. I did see another question about the process and the training. I use the training video that from 7 Generations Ahead that we start off with. And then I go to each classroom at the beginning of the year and we go through it. And then it takes like a good 2 weeks, I would say, for 3rd grade and up. It takes a little longer for kindergarten through 2nd to get the hang of it, especially our kindergarteners. I also run an after-school program called Green Team. And what is really great too is that they're always promoting and going around with their friends, and it's like the cool thing to do because we're being green and helping the planet. And then also there is I have a 2-week rotation of student helpers who work helping the kids sort out their foods. So it takes like a little bit, but they really get the hang of it fast.
Yeah, I would second that. I think it's more the adults maybe have a little bit of a harder time believing that the students can actually do it, and they totally can. And as Lauren said, it's the younger students takes a little long because they're juggling and it's hard for them to empty their milk, but they do catch on quickly. And with the share table, they catch on pretty much immediately. Like, they're excited to have that food there, and it's as long as they're aware of it. And that's a key thing, is making sure that all the students know that it's in a central location, that it has a very clear signage, that students know that it's there for them to use. Let's see. I know we're after time, so if you guys have to leave, but we're happy to answer a few more questions. What else do we have? Rebecca, Caroline, you guys,
There's a good
anything
question
jump out at you?
from Sarah Diaz, and she's asking, how are share tables effectively used when students don't eat in a centralized location?
Yeah, that is a great question. So go ahead, Lauren.
Something that I do here at Jan is I have some wonderful staff who are part of my green team, And one of them at the end of the day goes and grabs the share bin from the cafeteria. And so for all of our after school kids, all of our late pickup kids who are starving, we're always passing that out. And if kids are hungry, again, they'll eat that celery they didn't want at lunch, or they will take that bag of craisins. So we really do not waste a lot of, especially this school, very little gets wasted or composted for that matter. So that's what I have been seeing. Also, like I have for the breakfast that I have set up in the hallways, I rarely see food in there because they're grabbing it on their way to lunch or they're grabbing it on their way out of the building because they're going to go play on the playground for a while and they don't have a snack with them. So I see that happening all the time.
Yeah, I agree. I think also wherever, um, if there can be, some schools I've seen take around a cart in the hallway and just like stop by classrooms and ask if people want to put on or take things off the share table. Or I've seen it where there's a share table put in the hallway on a cart and students can get permission to go into the hallway to use it. But I definitely, there are schools without cafeterias that make a share table work.
And also for breakfast, because there are a lot of schools that
Mhm.
have breakfast in the
Yeah.
classroom and you can
classroom.
easily do it. And again, as you see, it doesn't have to be anything fancy. It can be a shoebox.
Yeah.
Like any bin that you have lying around, again, make sure it's labeled. And if you have an ice pack if you're collecting milks, but it's very, very doable anywhere in the school. It's just a matter of having those point people to get the food to the right place.
Another thing, like with that breakfast, is all of our kindergarten rooms from both schools always had share bins in their rooms because they do snack. And so for all those kids who don't bring snack, there's almost always something in that share bin.
Yeah, that's a good point.
hmm And then there's a question about implementing this in middle school and high school. Chicago Public Schools, all of elementary and middle schools, for the 90% of them are K through 8. So we do cover those grades.
Yeah, and high schools are different, definitely different animals, but we have implemented them. And I think if you talk about kind of maybe stigma or being apprehensive to use it, I think you'll encounter that more in high schools. But that's not to say they can't work. It's just more about, I think, the messaging and having it potentially come from the peers versus your peers versus administration. But there's definitely a need. We just did waste audits. We just did a waste audit in a high school, and there was so much fruit collected. It was mind blowing. So and milk and items, that could be used after school, especially like for sports and other after school activities. So it's definitely workable, but again, it has to be factory sealed items and or whole pieces of fruit. So a lot of times those a la carte items might not be packaged, so they're not share table eligible, but it can definitely work in high schools and middle
Yes,
schools.
I mean, we do preschool too here. So, and they do work here in preschool too, and they're all learning and they rarely throw things out. We also, some of the schools have a high need right now for sending home food. And so if there are things that are leftovers, those get sent home too.
And with the high schools, it'll be interesting to see, these kids, for example, that Lauren's working with as they grow up and get into the high schools. I think the stigma will be less because they've grown up accustomed to a share table.
Mhm.
For sure. Oh, yeah. Jen, our colleague from SGA, definitely brought up a good point about Solorio High School. They are in Chicago Public Schools. They are a model zero waste school. They have an incredible program that since like 2016, and they do have a share table. And you can get really creative in how you use this surplus share table food. They have like created recipes around the items that are left and made things, made like cooked with them at school. They can be potentially used in culinary classes. You can really get creative. And thank you for reminding me of that, Jen. Yeah, that's another way in high school. A lot of high schools have culinary programs, so that's another way to kind of repurpose that food. Any Anything else that we have? Any other burning questions? And if we didn't get to them, we will follow up in the email with everything, again, recording, all the slides, all the resources that we discussed, and our contact information. So thank you all so much for joining. This was great, and hope everybody has a wonderful afternoon, and stay warm if you're in a cold area and stay cool if you're in a hot area, because we're all over the place this March.